to my YouTube channel. In this video, we are going to learn about edema. Edema is a sign or symptom, but it is not a disease. Any disorders that perturb is nothing but disturb. Any disorder that disturb the cardiovascular, renal or hepatic function are often marked by accumulation of fluid in tissues or body cavities. The accumulation of fluid in the tissue is called edema and the accumulation of fluid in the body cavity is called effusion. Understand the difference between edema and effusion. Accumulation of fluid in tissue is called edema and accumulation of fluid in body cavity is called effusion. In normal condition, the vascular hydrostatic pressure pushes the water and salt out of the capillary into the interstitial space and it is balanced by the tendency of plasma colloid osmotic pressure that it pulls the water and salt back into the vessel. But not always the water and the salt pushed by the hydrostatic pressure is sucked by the osmotic pressure. A little amount of water is left in the interstitial space. This water enters the lymphatic vessel and it returns to the bloodstream via thoracic duct, which drains into the left subclavian vein. So it keeps the tissue dry. This balance is disrupted when the hydrostatic pressure is elevated and colloid osmotic pressure is diminished. It results in increased movement of the fluid out of the vessel. When the net rate of fluid movement exceeds the rate of lymphatic movement, then the fluid is accumulate. Now let's see about the types of edema, that is transudate and exudate. Nothing but non-inflammatory and inflammatory. Transudate is non-inflammatory and exudate is inflammatory. Do not forget and confuse. Transudate is non-inflammatory and exudate is inflammatory. Transudate occur when there is increased hydrostatic pressure or diminished colloid oncotic pressure, and exudate occurs when there is increased capillary permeability. When the capillary permeability is increased, it results in the outpouring of protein-rich fluid. Transudate is non-inflammatory, exudate is inflammatory. Transudate is protein poor and exudate is protein rich because of their causes. When the hydrostatic pressure is increased and the colloid osmotic pressure is decreased, the fluid that comes out of the vessel is protein less. But when the capillary permeability is increased, the protein that comes out of the vessel is more. There are some other types of edema. The edema may be localized or generalized and it may be pitting or non-pitting. It may be bilateral or unilateral, or there are many special types of edema too. Next, let's see about the causes of edema. Here are 4 causes: increased hydrostatic pressure, reduced plasma osmotic pressure, sodium and water retention, lymphatic obstruction. First is increased hydrostatic pressure. The hydrostatic pressure is increased during any disorder that impair the venous return. This may be localized or systemic. If it is localized, example is deep vein thrombosis, that is DVT, deep vein thrombosis, that occurs in the lower extremity. If the edema is systemic, example is congestive heart failure. Next is reduced plasma osmotic pressure, which is also known as reduced colloid oncotic pressure. The albumin account for almost half of the total plasma protein. So when there is inadequate synthesis of albumin or increased loss of the albumin from circulation, the oncotic pressure is reduced. Usually it is seen in cirrhosis of liver and protein malnutrition. When there is nephrotic syndrome, that is defect in the glomerular capillary permeability, the plasma oncotic pressure is decreased, which finally leads to edema. Next is sodium and water retention. When there is increased salt retention along with the water, there is increase in hydrostatic pressure and decrease in osmotic pressure. The hydrostatic pressure is increased because the intravascular fluid volume is increased. There is decrease in the oncotic pressure because there occurs the dilution, and this condition also finally leads to edema. Next is lymphatic obstruction. When a person have trauma, fibrosis or tumor, it disrupts the lymphatic vessel and impair the clearance of the interstitial fluid, resulting in the lymphedema in the affected part of the body. Example is filariasis. Filariasis is caused by Eucheriria bancrofti. The vector is Culex mosquito. It causes edema of the external genitalia and lower limbs. Commonly, filariasis is also known as elephantiasis. Usually in disease filariasis, there occur obstructive fibrosis of the lymphatic channel and lymph node, which leads to lymphedema in the affected part of the body. Next, let's see about effusion. We have already seen about effusion, that is accumulation of fluid in the body cavity is called effusion. For example, pleural cavity. The accumulation of fluid in pleural cavity is hydrothorax, and in pericardial cavity is hydropericardium, and in peritoneal cavity is ascites, or it is also known as hydroperitoneum. Next is pathogenesis. The common place of edema is subcutaneous tissue, lungs and brain. In subcutaneous tissue, pitting edema occurs. Due to gravity in lower limb, the fluid gets accumulated. It is also known as dependent edema. It occurs when long standing and sacrum recumbent position. Next is periorbital edema. Edema that occur due to renal dysfunction is periorbital edema. Usually, when there is renal dysfunction, the edema occur in loose connective tissue such as lower eyelid, that is known as periorbital edema. Next is pulmonary edema. The lungs become 2 to 3 times more weight than the normal. Next is brain edema. Brain edema may be localized or generalized. When the brain is swollen, the sulci becomes narrowed and gyri is widened. When the brain is swollen, there is a chance of getting compressed by the skull. Therefore, brain edema is life-threatening. Sometimes, when the brain is swollen, the brain substance can herniate through foramen magnum and compress the blood supply of the brainstem. Next is clinical features. The edema signals us about the cardiac disease and renal disease. And edema impairs the wound healing. The wound will not be healed faster, and pulmonary edema usually occurs due to left ventricular failure. When there is pulmonary edema, gaseous exchange is also affected, and peritoneal effusion occur in portal hypertension. Like, share and comment my video. Do not forget to subscribe my YouTube channel. Thank you for watching.